Hey and welcome to the EYFDM Podcast, brought to you by the EYFDM Podcast team. This podcast is accompanied by a study on listening behavior. Nadine, what's the study about?
Hey Fabian, I'm always listening to podcasts when I'm on my way to university every day. And I'm sure most of you are listening to podcasts too in your everyday life. But have you ever wondered how different podcasts influence your career choices or your personal life?
Well, if you want to find out more about the study, there's a link underneath this podcast in the bio. And now,
have fun with our EYFDM podcast.
Hello and welcome to our 6th episode of the EYFDM podcast. My name is Fabian and we are again recording from Brussels in Belgium today. And I have another special guest here with me, Lucie Blondé, who is a GP specialist with a vested interest in migrant health and neglected populations in primary care. And I think it's going to be a very interesting podcast about how to include neglected communities into your GP practice. Hi.
Hello. Hi, Fabian.
It's really good to have you here in Brussels. It has probably been quite a train journey for you to come here.
Yeah, indeed. I must say I'm still recovering. I did consultations whole morning.
All right. Thank you so much for taking the time off your busy day.
With pleasure.
So you work in Ghent in a community center.
Yeah, community health center.
How do you make that happen? What's your job there?
There I work actually as an official GP, normal GP as people would imagine it.
Mm-hmm. So a clinical role.
Clinical role, yes. Except that community healthcare center is a neighborhood with a lot of, like you say, neglected people or people that don't have that easily access to healthcare.
And what would be typical patients that you see?
People with migration background, people that speak another language, sex workers.
Mm-hmm.
Yeah, all kinds of populations that don't have easily access to the normal healthcare system.
Oh, that must be also very challenging.
It is challenging. It is challenging and rewarding at the same time.
How did you become interested in migrant health?
That's a good question.
Thank you.
I think my journey started already before I started studying medicine. I think I chose medicine with the feeling that I had a lot of privileges and I wanted to change some injustices in the world.
Mm-hmm.
That's why I also started working with Doctors Without Borders. However, also during this work, I realized that actually if you start looking at your patients and learning more about public health and determinants of health, you can see that there's a lot of work that doctors do. So in med school you learn a lot about clinical health and the diseases and sicknesses of people. But at one point when I, for example, went for voluntary work in a refugee camp in Duinkerque, it's in the north of France, and there's a lot of people living there that want to cross the sea, to cross the channel, indeed. And I was very emotioned by this because it's so close. It's 1 hour driving from my home, and I saw
very different reality. Probably.
A very different reality. Exactly. And I didn't know this. I didn't imagine this. So I decided that I wanted to work more and learn more about these people and understand what is happening to them, why they are there, and try to make them a little bit healthier or alleviate some of their suffering.
And that was in medical school?
Yes.
Wow. And then how did you continue doing that in your GP training?
Yes, well, you have to work in an official practice. So there I did it next to my GP training or in the weekends. I came to Brussels. There was also a refugee camp here in the park of Maximilian. And I continued going to Duinkerque as well and to Calais. And yeah, it helped me a lot. It learned me a lot about family medicine and first line care as well. And I took it with me also in my GP training.
So you did full-time GP training, and then during the time off, you decided to do some more medicine.
Mm-hmm. Yes.
Oh, wow. That's very impressive.
Because that's the role I could do there.
And then once you specialized, you probably ended up doing more migrant health.
Yeah. So back then, I decided that I really wanted to continue with this. And I went to the ITM, to the Institute of Tropical Medicine, and I studied there tropical medicine and international public health.
Wow.
I did a postgraduate. It's not a master. It was 8 months.
Diploma.
Yeah.
Just what you do while working full-time, of course.
No, so I stopped working.
All right, okay, cool.
Yeah,
So you took a break.
I took a break.
Yeah.
Yeah, I worked 1 day a week in the sex workers community. It's an NGO that works there.
Mm-hmm.
Yeah, to have some money. And in the meantime, I studied. And I really recommend it. It changed my way of looking at primary care. Like I said before, at med school, we learn a lot of amazing, interesting things. But it's mostly the clinical focus.
Mm-hmm.
And other determinants of health are mentioned, but not really deepened. And there you learn about organization of healthcare systems and what determines the health of people. And you realize that actually we focus on medication and antibiotics, and it's amazing that we can cure people like this. But a lot of patients that we see are actually sick because of other things. They have a pneumonia and you can give them antibiotics, but maybe they have a pneumonia because they live on the street or they live in a house with mold. So
the antibiotics don't really solve the problem.
Exactly. And then you realize, okay, maybe I can give better care if I have more attention to these subjects. But the system that we currently work in doesn't really give a lot of attention, facilitate this form of care.
Yeah.
So I tried to find my way in this as a medical doctor, and I passed different stages after studying tropical medicine.
Mm-hmm.
I first decided to apply with Doctors Without Borders because that's the thing you do after studying
Well, that's a long commitment, isn't it? It's a big commitment. Can you tell us about how does it work? You just call them and say, hey, I just finished my tropical medicine diploma. Can I come? Or how does it work?
Yeah, that's the first phone call. But it's more complicated than that. Because it's a big commitment, and it's also a big commitment from their part. They really try to screen you or to ask about your engagement. It's a big interview. It's also, you have to go through a lot of personality tests.
Oh, wow. Mm.
Yes, which is very interesting also to learn about yourself. You have to meet a lot of requirements, languages. Actually, you also need more than medical skills. You need organizational and strategical skills, because they try to, this is a long story, but the organization tries to decolonize, if I can use that word, as much as possible by only sending expats like me when there's not really another alternative. So mostly now they will hire national staff. Mm-hmm. And the expats will mostly do organizational things and management functions. Mm-hmm. So, for example, one of the missions I went to was on the Greek island of Lesbos. Mm-hmm. It's a Greek island and it's before the coast of Turkey. Mm-hmm. There's a big refugee camp there. Maybe you know it. It's called Moria. Mm-hmm. And now it's called Mavrovuni now, however. So there's Doctors Without Borders has a mental health clinic and a sexual and reproductive health clinic, because those are the two main gaps in healthcare. On purpose, they put these clinics actually out of the camp because their message to the healthcare system of Greece and Europe is that, okay, actually, it shouldn't be the case that we have to provide these clinics. And these people have the right. They're in asylum procedure. They have the right to healthcare. But because it's not there, we will still organize a clinic. Yes. And there I was the medical activity manager of the sexual and reproductive health clinic, meaning a multidisciplinary team of nurses and psychologists and midwives and doctors. I also did consultations myself, but mostly it's the Greek doctors and nurses that organize everything, that see the patients, and me more network researching and meetings with Ministry of Health and those kind of things. It's very challenging, but very useful work, I think. And I learned a lot.
How long were you deployed? How long did you go to Greece?
I went several times there, actually. I went a few times not with Doctors Without Borders, but more in little grassroots organizations, really working on the ground, really pulling people out of the water and providing first aid and first line primary care, because, as you know, people that are migrating are experiencing a lot of traumatic events and are living in very dire circumstances. and don't have access to healthcare. So that means as a GP, you can do a lot. It's mostly infections, panic attacks, and then people who have a chronic morbidity that don't have access to their meds anymore, hypertension, diabetes, etc. And so in total, I think I was there maybe on and off. Yeah, since 2015, I was there every year.
Wow.
The last mission was 8 months, I think.
Wow, that's a long time to be away
Yeah.
in one go.
If you apply with Doctors Without Borders, that's engagement you have to give because they train you. It's a different kind of medicine. They invest a lot in you, so they really ask this engagement. It's a different environment. So by the time you understand how everything works, already 2 months have passed.
Yeah.
So it's minimum 6 months.
Is it something you would recommend? Would you recommend to younger GPs this is really a good way?
Well, it depends what your intention is.
Mm-hmm.
I went there because my intention was, okay, I really want to be the most useful doctor in this world. But actually, I learned by doing it, of course, that there's a lot of sense in humanitarian aid. There is also a lot of nonsense. And that in the end, my place is more where I know the language and the context.
Mm-hmm.
And I can be also, next to my job, a little bit more politically active or advocating for certain topics. So if your intention is, I want to go there, help people, and also live an adventure, then
you'd say go for it?
Then it's beautiful work that they do. I'm very happy that they exist.
So that takes us a bit back to Belgium now. And so after you decided to come back, you went back into your, I'd say, day job as a GP. Was it hard to settle back in and talk to patients about, in quotation marks, normal problems?
It was very hard to be back, indeed. It's such a different reality. However, as a GP, your job is to see every patient or every person into his or her context. And every problem is, for this person, a problem.
Yeah.
And as I said, I think it's very useful to be able to follow people for a longer time.
And that's probably something in the refugee camp you can't follow up a lot.
No.
It's more
and
acute
it's very
care.
frustrating work.
Yes.
Yeah, because you can only do what you do there very vertically. And it's what I was saying before. Indeed, you give antibiotics, but you cannot get them out of the refugee camp.
Yeah.
Luckily, Doctors Without Borders is an organization that does this, that has this as one of their pillars. That's why I applied with them and not with other NGOs. Like
what pillar do you mean?
Advocacy and witnessing.
Okay.
The other medical organizations, they provide medical care, which is amazing, like Red Cross, for example. But Doctors Without Borders, they not only have medics, they have a lot of legal people and they have a lot of journalists. That's how they started. So they are using the data that the doctors provide. So many gastroenteritis and so many measles. And so they're using this data and
trying to influence policymakers.
Yes, exactly. To make sure that the camp doesn't exist anymore, because that is what makes people sick.
So that's probably also what made you move into policy making and research then.
Yes, exactly. Yes. It's the same feeling.
It's the same feeling.
Yeah.
And is that common for people who spend quite some time, I would say, on the ground to come back and then become researchers and policymaker?
I think so.
Yeah.
I think it's common. You have different kind of medical professionals, and some of them, they will keep on going doing humanitarian work for the rest of their life. And it's great how they do it, but it's 24/7 work.
Yeah.
It demands a lot of you, and you have this part of frustration that's always there, that I call the nonsense of humanitarian work, because you feel that you're fighting against something, but you cannot really change it. It depends on the mission, of course, but this feeling remains there.
Yeah.
So here in Belgium, I can also see a lot of health problems, a lot of injustices, more than people think. You don't need a disaster or a migrant camp for that. And here I have some more power, or I have some more privileges to use this information, to bring it to the right people, to make reports, to write an open letter with other doctor colleagues, to write to the Minister of Healthcare in Belgium. And this doesn't solve the problem of the patients before you, but it gives you a feeling of, okay, I'm
Self-efficacy, being able to actually trying to change something about the circumstances.
Yes, exactly.
So how do you make all this work in your life? Migrant work, you used to work as a detention worker, sex work, normal GP work, coming to podcasts like this one. Sounds like you have a very busy week. Do you have more hours in your day?
I wish. Yeah, well, it's a difficult question. I'm just gonna talk out of the top of my head. I like it, first of all. You can meet a lot of people that normally you would never meet. You share people's secrets. You get to know their context. You learn from them a lot. It changes my entire being and it gives me a lot of energy. Yeah, of course, it's necessary for me to feel happy, to feel useful. And I think the combination of these two, both the clinical thing and the advocacy, gives me the right balance to keep doing this job for many years to come.
Perfect. Thank you so much for sharing that. We have a little game in this podcast, which we adapted from a German podcast. You might have heard about it from some of the previous episodes. I'll quickly explain it again. There are 50 word pairs, and the idea is to pick one of the elements as quickly as you can, and then move on without thinking about them too much. In 10%, so in 5 cases, you can just say next or skip if you're unsure, or if it's something where you need to elaborate on afterwards. And yeah, it's a fun game, and I would say, let's go. Are you ready?
Yes.
All right. Coffee or tea?
Coffee.
Dutch or Flemish?
Flemish.
Flemish or English?
Flemish.
English or French?
French.
Turkish or English?
Turkish.
Spanish or French?
Spanish.
Spanish or English?
Spanish.
Mountains or oceans?
Oceans.
Cash or card?
Cash.
Coffee shop or restaurant?
Coffee shop.
Belgian waffles or Belgian chocolates?
Chocolate.
French fries with ketchup or with mayonnaise?
Mayonnaise.
Vegan or vegetarian?
Vegetarian.
Prison medicine or general medicine?
General medicine.
General medicine or family medicine?
Family medicine.
Prison medicine or medicine without borders?
Medicine without borders.
Dogs for climate or a heart for refugees?
A heart for refugees.
Tropical medicine or international health?
International health.
Public health or international health?
Public health.
Brussels or Antwerp?
Brussels.
Greece or Ethiopia?
Greece.
Voluntary work or full-time employment?
Voluntary work.
Full-time employment or part-time work?
Part-time work.
Freelancing or secure employment?
Freelancing.
Class learning or workplace-based learning?
Workplace-based learning.
Strength or endurance?
Endurance.
D'Urgent or Sint Barbara Scouts Ghent?
Wow. D'Urgent.
We'll have to talk about that. Morning or evening?
Evening.
Past or future?
Future.
Workshop or presentation?
Workshop.
Education or clinical work?
Clinical work.
Postgraduate study or clinical work?
Postgraduate study.
Humanitarian medicine or tropical medicine?
Humanitarian medicine.
Paper or digital book?
Paper.
Mask or no mask?
No mask.
General practice or research?
General practice.
Western or traditional medicine?
Traditional.
Public health or tropical medicine?
Public health.
Sparkling or still water?
Still.
Turkey or Belgium?
Belgium.
Food security or food safety?
Food security.
Policy work or clinical care?
Clinical care.
Call or text message?
Call.
Live event or digital meeting?
Live.
Checked luggage or carry on?
Carry on.
Plane or train?
Train.
Train or car?
Train.
Bicycle or walking?
Bicycle.
Well-being or keeping busy?
Wow. I should say well-being, but I think it's keeping busy.
That was it. Thank you very much. So one of the pairs where I was probably really bad at the pronunciation was D'Urgent or Sint Barbara Scouts Ghent. What is that?
That's a long time ago. D'Urgent was my student organization, not the one that I was part of.
Is that the one that you went to the different camps with as a student?
No. It was actually a climate-based student organization.
Right.
Yeah, because Dur is for sustainable, which is in Dutch duurzaam, and Ghent is the city of Ghent.
Right. So that's probably the next topic is climate change and climate change policy that
Okay.
you're interested in, right?
Yeah.
Yeah. Wow. Yeah. Why not just have another special interest?
Okay. Yeah, well, indeed. It's actually linked also, because it's also linked with care and caring for people and seeing that people are sick not only because of virus again, but also because of the environment and the climate they live in.
Mm-hmm.
So it came a little bit from the same sentiment.
Yeah, which is probably public health. It's how to prevent
Exactly.
the living circumstances.
Exactly.
Right? Oh, interesting.
Yeah.
That's how it's linked, yeah.
Yeah, and it became a special point of interest just because I didn't learn this in my medical studies, that half of the strokes and no, not half, but 25% of the strokes that we see are caused by air pollution. And that if you live in a city like Ghent, that actually it's like smoking 1 pack of cigarettes a day.
Right, yeah.
So I thought, okay, why, if we are trying to make people stop smoking, should we not try to make our air healthier also?
Yeah, good point. Yeah, so that's how it all comes together. So one of the last word pairs was well-being and keeping busy. So is that your secret, by keeping busy to maintain your well-being?
Yeah, that's a very difficult question.
I know.
Yeah, I think that's my secret, but I have to beware of my borders there. I believe that borders are a terrible invention in the world, but for people themselves, it's a good invention. And to be able to keep on the work that I'm doing, I have to not forget about the well-being and not forget that I cannot fix everything. It's really a balance that is an everyday exercise.
So if you look back at all these different special interest groups and combining it with clinical care and combining it with all the different clinical work elements, sex workers, working with prisons, is there anything that you would recommend to young GPs who might have just started their training and who are looking to pick up a special interest or to get more involved in migrant care or migrant healthcare? Is there any recommendation?
Yes, go and study public health.
All right, yeah.
That's the start. You will see that there will be a lot of people sitting next to you that have the same vision. So it's definitely possible to implement this way of thinking more in our healthcare system. And then try to keep it with you, because we are working in very pressured environments, and it seems like for all doctors there's a rat race and there's prestations to be done and you have to keep on following, and there's always a lot of work. But I think that it's important to keep in mind that this connection with our patients and these stories and the beautiful things that I said before, that we can live as a GP, the context of patients, learning from them, hearing their secrets, trying to alleviate a little bit of their suffering and a little bit of their pain, hopefully. That is very valuable and often forgotten. So practically, how can you do it? Find like-minded doctors, work together in a community health center with other disciplines as well, nurses, psychologists, physiotherapists, and also try to not forget the societal and social determinants that have an impact on people's health and have an interest for it, and maybe choose one and try to change it, the one in your neighborhood, the social housing or the quality of air. If all doctors would do this, I think we would not have that much work anymore, because there would be less sick people.
Thank you, Lucie. I think that's a perfect last advice. So if we all now go and change one thing in our surroundings, then we are all unemployed doctors.
Exactly.
Thank you very much, Lucie, for taking your time out of your very busy day and schedule. Thank you for being on this podcast, and hopefully you'll meet some of our listeners on one of the next EYFDM events.
Okay, I hope so.
So you can always probably go and just say hi to Lucie.
Yes,
and if
I
you're
would
interested,
love some feedback.
Yeah, if you're interested in migrant health, always Lucie's probably a very easy person to approach, who you will probably see around on the EYFDM events.
Thank you very much.
Thank you so much for being here.
I was very happy to be here.